So welcome to part 2. So I was able to get out of pain with seeing Joel Proskowitz, and when I started ramping up my activity, the pain would come back, not as bad. So I was a lot stronger, I had better endurance, I would bounce back a lot quicker. So previously, if I would have a flare-up, I would be down for a week or two, unable to do much. Whereas after I started doing the exercises and having Joel help me, when I had a flare up, it would set me back maybe 2 or 3 days at worst. And I was able to go back quickly to my long walks, whereas before it was obviously a lot longer. So there was a big improvement in my symptoms, and I learned a lot about spine hygiene and how to move and sit properly, etc. That was really an important lesson. I learned so much from him. But my path did then lead to me exploring other medical interventions. So I started going for facet blocks and caudal epidurals, and they did help bring me pain relief, tremendous pain relief actually. I met people at the surgeon's office, for example, who would say to me, oh, they've been out of pain for 5 years. So the caudal epidurals and the facet blocks, from what I read as well, work for a lot of people for a long time, and they're able to keep the pain at bay and avoid spine surgery. But in my case, the pain relief lasted about 2 to 3 months, and then I would need to go in again, which was fine for me at the time. I was able to keep that up. That wasn't an issue. But for some reason, my lower back started to get a little bit worse. So then I went for a rhizotomy. My first rhizotomy brought me pain relief for a very long period of time, for about 3 to 4 months, if I remember correctly. It was a great time. I had a great time. I was able to do my normal activities. I wasn't causing any more damage to the disc. It was just the disc that didn't have much fluid left in it. And it was great. So I had a few rounds of rhizotomies over the years, and those were fantastic.